when we try to understand the connectivity between digital health, between COVID-19 vaccination and blockchain solution, I hope that those in our session will benefit from both understanding the challenge, but more precisely looking at the potential for blockchain to provide solutions. And for that, we have excellent additions to my presentation to you with the panelists that will come up just in a few minutes. Is it possible to move the slides from your side, mate, as I have no control at the moment? Thank you. So 2020, 30th of January, the United Nations is declaring COVID-19, the virus that you can see on the left upper side of the slide, as a public health emergency of international concern. In the next slide, we shall see that this is not just a concern. This has been actually also declared about a year ago as a pandemic, which means an infectious disease that is a global public health threat, which takes the lives and impacts morbidity of people around the world in a large proportion and in many countries at the same time. And we are looking at the chart, which is accurate as of yesterday, of the cumulative confirmed death from COVID-19 to realize that this is a dramatic effect of our world. If we add to that the economic consequences and crises that are attached to COVID-19, we can understand the devastation on one hand, on a personal level, family level, community level, and global level, but at the same time, the urgency that is necessary in order to provide solutions to this catastrophe around the world. And the next slide would actually talk to the question of vaccines. Vaccines that have been developed in a speed way, no precedents to that nationally, globally ever, have been our hope and are actually, if we see the next slide, providing dramatic change in the characteristics of the pandemic in those countries that are able to provide vaccinations to their population. And we can see the two ends, at least with this updated graph that shows the per capita, that means for every 100 people, the number of vaccinations already inoculated. So Israel is leading with over 120 such doses per 100 people. And as we have heard the news from India, we can look at this slide and immediately understand the difficulties which India experiences with actually only 10 of every 100 people being vaccinated. And in the middle, all other countries that are fighting for access and for the possibility of protecting their people and their populations. 16 years and above, there is no vaccine yet for under 15-year-olds approved anywhere. And this is slowly, but hopefully effectively changing the world we are in. But when we talk about the vaccination challenges, please, the next slide, we can also see that while there is a coming together of the world under a mechanism called COVAX, which is led by the World Health Organization and UNICEF and a few other international agencies, and I'll come to the United Nations in a minute, we can see that while the numbers are quite superb, you know, over 43 million doses that are shipped already, we are talking about a problem that is affecting the whole world. So we need billions of vaccinations to be available and billions of people to have access to these vaccinations. So as impressive as these numbers are, they are actually very limited in terms of our ability to really give a change or develop a change through vaccinations unless we are more efficient, more effective, and are able to communicate better among nations, among ourselves. And in a minute, you'll see how blockchain comes into a play there. The next slide, May. Thank you so much for your support. So we are actually looking at an interesting junction between blockchain and global public health. That's not a natural connectivity or a natural junction. But if we look at the famous white paper from 2009 of Satoshi Nakamoto, whom we all know by heart, the talking about the Genesis block, well, in a way, we in this very important summit, very interesting summit, and very I hope, continued summit, are developing the genesis block between blockchain and global public health, and in this session, particularly around vaccinations. So when we think about pain points, markets, and deal makers in the context of blockchain entrepreneurs, developers, manufacturers of ideas throughout the world, we can see how the livelihood of this junction could be also providing and promising solutions in the context of the current pandemic we are in. The next slide actually brings us to the question of the blockchain within a context of a global effort, which is the Sustainable Development Goals. I'm not sure all of you are familiar with the Sustainable Development Goals, but these are the 17 goals that have been launched by the United Nations, representing all 193 members of the UN and beyond, with a hope that by 2030, what we call the 2030 Agenda, we shall see a better world for ourselves, for our children, even for our grandchildren. And the question is how those Sustainable Development Goals could benefit from blockchain technologies. I'm showing you just two very recent efforts to discuss this, and we are now at a very unusual summit, a unique summit to further that discussion that had started in March with INADBA, which is the non-for-profit bringing together entity of interested parties around blockchain technologies and their promotion, and the United Nations Economic Commission for Europe that has held its event in Geneva just over a month ago. And why am I mentioning this? Because as we shall see in the next few slides, we can move to the next one, we would like to answer a question which is very concrete and has 6 answers that I will offer that relates to the potential context of blockchain technology developers and their interests, economic interests, financial interests, funding interests, and R&D interests within the context of global public health and specifically COVID-19. So what we see is actually that the United Nations agencies, and there are quite a number of them, over 32, are embracing blockchain. And this seems to be to some, what's the big deal? Many are trying to embrace blockchain, yes. But for the United Nations, this very bureaucratic global body, to be among the very first ones to already implement projects, pilot projects, to finance, to hire people who are experts and consultants in the blockchain arena is a big surprise. And so I'm trying to offer in the next 6 slides, 6 answers to this question. I hope you bear with me, and we see that connected immediately to vaccinations thereafter. So the next slide would offer the first answer to why is the United Nations embracing blockchain technologies. First, because as we can see in the upper side of the slide, we are not doing, as a global world, really too good on advancing the SDGs, which encompass a whole set, which I won't go into, of targets and goals, some of them in education, others in health, some of them are in protecting small islands, protecting the economy, protecting jobs, and so on and so forth. And as it has been already 6 years since 2015 when the SDGs have been launched, there is a great need on the side of the United Nations leading this effort globally to find new solutions. And that's where we are. Blockchain technologists could offer new solutions. The next slide. Another answer could be actually in terms of the bureaucracy, the inefficiency, the old-fashioned way that the United Nations functions. And it is under that criticism that when embracing blockchain, there is a new, if you want, vibe within the United Nations and with its ability to present itself as coming closer to innovation, embracing innovation, looking into blockchain as a supporter, not just for the absolutely necessary new solutions, as I mentioned in answer number 1, but also in terms of the image of this organization. And the next slide. So when we are talking about resources which this organization or organ is lacking, because of previous US administration cutting funds to the United Nations because there is reduced income in general, so member states are delaying their payments to the United Nations, etc. There is a high demand on the side of the United Nations agencies for innovative resource mobilization. So it could be Bitcoin, could be other cryptocurrencies, and could be also other financial and decentralized finance that could come as a great resource and support to the United Nations. We are halfway, so we moved now to answer number 4, which talks actually to the characteristics of the employees, the new employees of the United Nations. The different agencies are among the largest providers of jobs around the world, and working for the United Nations is something that many people, definitely young people, are aspiring for. So we see the change in the characteristics of the workers, the consultants, the employees of the UN, which are more of the millennials and more influencers in their own capacity and community using social media, digital media, and others. So that's another reason why there is an embracing of blockchain by the UN. And the next answer is actually talking to also the fact that there is a lot of similarity between the United Nations characteristics and blockchain in principle, or DLT. So we are talking about decentralized body. The UN is not one government, it's not owned by one government, it is multinational, it is global, just like the aspiration of blockchain. And its ability to demonstrate easy interoperability is also out there, because once you are plugging in and plugging out of one agency to another as an employee, the language, the protocols is quite easy. And the last one, as an answer, might be a kind of a reverse metaphor, if you want. So it's maybe not that the United Nations is embracing blockchain, but maybe blockchain is embracing the United Nations. There is a lot of interest at the level of blockchain policymakers, community of developers, those who are looking for finance, for stability, for partnerships. On our side of blockchain, we find the United Nations and are finding the United Nations to be a great partner. So if we move to the next slide, we are now coming back through this key message to understand that digital technology has the potential to drive a better, more sustainable economy for all, but it's only if it is on a continuous and a continuous dialogue between innovators and society. And business, in this case, blockchain business, could be the bridge for the conversation. So I showed 3 bridges before: pain points, deal makers, and markets. And here we have some of the answer to that. The next slide, please. So there are 6 domains where actually we can see blockchain solutions absolutely and immediately necessary in the context of the vaccination challenges. Let me spell them out quickly for you. The first is the micro-planning, and the challenge here is to be able to target previously untargeted groups for vaccination. Counterfeit detection, we know this in other areas of economy and drugs, or medications, I mean. And here the counterfeit of vaccines, the damaging of the trust and the demand around this huge effort COVAX is doing is absolutely an important other area where blockchain solutions come into play. Also, the issue of verifying vaccination status, and I'm not just talking about the green passport or the green certificate, but there is a lack of real-time authenticated information on the proof of vaccination, which is definitely at all levels that one can think of. There is also the question of the actual vaccination monitoring. The challenge here is to ensure targeted populations have been fully reached and that there are no dropouts. And there is also the issue of safety monitoring, an extremely important point when we are discussing a medical problem that needs a public health solution. So the recording of COVID-19 vaccine development time, the making of and the monitoring of adverse events is more critical than ever. And here we are again with blockchain solutions requested, quested, and hopefully soon provided by perhaps some of you even on this session. And the last one is around terminology which is not yet frequently recognized, and the word is infodemic. Infodemic is the over access of misinformation, fake news, access of information that disturbs the more authoritative and respectful and definitely verified scientific information that relates to vaccinations. And it also contributes then to vaccination hesitancy, people who are afraid to be vaccinated because they are influenced by digital media, social media, bringing false information or politically driven information or other interested parties less than the public health responsible messages in this area. And this is one of the key drivers, as we know, of under-vaccination. So with all that in mind, those 6 pillars of areas of work, next slide would ask then what are the potential ways to deal with the blockchain solutions. And I'm sending a very short piece of pitch on a bridge that Impact is creating between the blockchain community and the global public health community, being myself on the 2 sides of the same coin, so both being a global public health expert and a specialist and a champion for blockchain for SDGs, and you have my contact details if that would be supportive for you. But I would like to move now to the second part of our session with the next slide and share with you the concrete solutions which are available.
Hello everyone, my name is Ilan Melendez and I'm coming here to ask you a question. Have you ever wondered where is the COVID-19 vaccine you are going to receive? Or where it comes from a trusted source? Or actually, is it in good shape for administration? Have you ever wondered if the credential of that vaccination is actually trusted by other authorities worldwide? If you have asked those questions, you are not alone. Welcome to Immood Trust. With Immood Trust, residents in Latin America and the Caribbean can see where their vaccines are, schedule their appointments, and use the tokenized representation of their dose as a verified credential of their immunization status, following bioethical advice to impact the pandemic as it best. With a blueprint of a white label solution designed by blockchain, countries can manage their COVID-19 vaccination efficiently and transparently. With Immood Trust, countries have the possibility to choose from a menu of components what is best to tackle their needs. The first component is the immunization record, which is actually the credential of the verified credential used by the individuals to show to some other authorities the status of their vaccination. This is in compliance with ID 2020 and the Good Health Pass standards. The second component is the track and trace functionality, enabling the countries to have a transparent control throughout the supply chain from the moment of those vaccines are put into the country and then administered to the beneficiary. And the third component is the transparency model, using advanced mathematical models, enabling countries to create strategies to better tackle the pandemic using vaccination as an additional tool or additional layer to accomplish better results. This solution, designed by blockchain and developed by a set of partners, it's allowing to countries to have a dashboard of the status, a big picture of the status of the vaccination, enabling to break down into batches, boxes, pallets, and doses. We are enabling with this solution to receive alerts of the status of the lots or batches, see a breakdown of the demographic distribution or in the status of the process or in the status of the location using complements artifacts of this kind of solution. In addition to this, we're enabling two alternatives. The first one is the solution that is actually for the individuals, where they can see their status and manage their credential. They can use this application to see where is the vaccine assigned to them, where when is their appointment, or if they can reschedule their appointment, and they can use this as a wallet to show to some other authorities the credential of the status of their vaccine. In this solution, what we are looking is to enable the people to have control for their records and use this as a proof or identity of who is going to receive, and they can complement this with a physical document to confirm who the person really is, and also use this as mentioned for their own records of vaccination. This is really important because when we match this application, which is for individuals, with another application which is actually for the healthcare personnel, we can scan in 3 clicks, or in 3 clicks we can tackle the efficiency gap that we have in the whole process. Healthcare personnel not only can see the people who is going to receive and it is actually a point for that day, they can also validate scanning the ID of the person, the conformity of that compliance, and make sure the person who is going to receive the vaccine is actually in the priority list. Additionally, in the second click, they are going to validate the person who is going to receive it and scan the dose which is going to be assigned. Once the dose is scanned, the person can confirm if there happened any issue in the process or not. Important part here is once it's submitted, the match is going to be completed and the credential is going to be done for that person of the status of the vaccination in a way of a non-fungible token. The beneficiaries using this technology will have a wallet where they can use to present their credential to some other authorities. In this case, user can verify the status their vaccines and confirm where they are valid, where they are status, the issue, and the claims of it. This is the same technology that some other users, as other authorities, can use as well to validate their status.
It's Michele Nati, and I am the Head of Telco and Infrastructure Development at the IOTA Foundation. I'm also COVID Solution Lead. Today, I'm going to present HelpUs, a solution for decentralized and interoperable green digital certificates, a solution that we develop in partnership with our partner Zebra Technologies. It's becoming more and more evident that vaccine certificates are becoming important for our life and coming back to a normal life where we can safely travel and we can safely move across different countries. However, we are facing the risk that these tools might be designed in the wrong way and become tools for people to feel like they're losing privacy and they're controlling their movement. So we need to design solutions that are at their core providing data protection as a first principle. So for that, we provide a vaccine certification, creation, and verification infrastructure that is flexible and inclusive because minimize or eliminate barrier to citizen participation. It use, like we will see, different medium for collecting this information about vaccine certificates, in particular mobile phone and cards. It's secure, user-centric. It provides GDPR compliant solution. In fact, all the information are carried on a user own device and are shared only with user consent. There is no sharing of data with an authorized third party. The solution provides security, data protection, and privacy for citizens. Moreover, identities are attached to the different shared information and are this identity owned by citizen, supporting the principle of self-sovereign identity and self-sovereignty of our data. The infrastructure is open interoperable, is easy to integrate with existing infrastructure, and is reliable. In fact, it scales and offers an open governance to control the access to information. We base this using the concept of self-sovereign identity, decentralized identity, and verifiable credential. We do this by identifying the actor involved in this ecosystem and creating identities for them using the IOTA ledger, IOTA tangle, which has scalable, feeless, and secure DLTs, where as a public key infrastructure, key of issuer and holder are stored on the ledger in the form of unique identifier representing a public key that controls that identity. The private key is always managed, owned, and secret to the respective party, issuer and holder in this case. When a holder, a citizen, goes to a vaccination center and want to receive a vaccine certificate, the issuer create a digital form of this vaccine certificate using verifiable credential standards and sign this with this private key and give this to the holder. The holder carrying his device and present to the verifier, which is an authority, an airport authority, this information. This information is read in a digital form, control that all the information are as required, so the citizen has a COVID negative test result, or has a vaccination certificate, or has recovered from a COVID previous infection. And to verify this, verify the signature of the issuer that is including the certificate. It does this by simply accessing the ledger and checking the identity and the key associated to the health center that signed the certificate, and see that it's a recognized health center. It's not a fake one that is issuing certificate for an authorized citizen. I can do this without necessarily connect and talk to the issuer center directly. We use IOTA Ledger because it's free to use, doesn't require to hold token in order to create digital identities, and has low energy requirement, and also it's also scalable. It's also open source and managed by a not-for-profit organization which is based in Germany, like the IOTA Foundation. It overcomes the limitation of blockchain in terms of scalability and fees, and provide a structure that allows to manage data transaction for creation of keys attached to public identity that are used to carry certificate and sign certificate. The infrastructure can be run as a standalone or can be interconnected with a way to exchange key information like proposed by the EU Gateway. In our solution, the information about keys used for verification of certificates is accessible using the IOTA Ledger and the IOTA Identity Framework. The issuer, health authority, issue a certificate after verifying the identity with a KYC inspection of the citizen to a citizen, either in his mobile phone or attached to a card, and the holder then present this to a verifier that acquire this information, and they can verify the signature authenticity. We use IOTA Ledger, which is a DLT management for profit organization, and we have a solution that's polymorphic in nature. In fact, can be adapted to many different solutions and provide two different ways to carry this certificate. One is with smart card, the other is with smartphone. In our smartphone solution, we have an application that allows to create digital identifier on the ledger and allow to log in into a health authority website, from which we can request a certificate that is issued by including the signature with the private key of the health authority and the information in terms of public key of the citizen that received this certificate. All of them, they are stored in the mobile phone and then can be presented to a verification authority that acquired them from an NFC interaction with the mobile phone or in the form of a QR code, and then can be extract the signature and use the ledger to verify the signature coming from a verified health authority. The same we do with cards. In this case, certificate is stored in the card, not in the phone. So this allows people that want to travel with the phone or doesn't have access to latest mobile phone or want to use this as a backup to carry this information in a card. That's already biometrics information to recognize that is legit citizen presenting it, and use the same mechanism in terms of scanner to acquire this information from NFC and then verify this using the ledger. At the end, we have a solution that is secure and scalable, maintained by the IOTA Foundation. We use standard like W3C TAT document and verifiable credential. We use security on cards and mobile phone, and we verify integrating other technology like KYC or ADAS identity integration for verifying users and citizens that receive this information. We are flexible and inclusive, user-centric and secure, open, interoperable, and reliable. This is it. If you want to know more information, these are my contact details. Please feel free to get in touch.
Hello to all, my name is Peter Kern. I'm Chief Operating Officer at CargoX. CargoX is a platform that enables original and confidential document transfer in a trusted digital environment. So we're using verifiable electronic signatures to use to sign, endorse, and transfer documents and data over blockchain. So what can CargoX do to facilitate and to add value to the COVID vaccine supply chain? We facilitate exclusive and private creation of ecosystem within the CargoX platform, where the COVID vaccine supply chain stakeholders can create their exclusive and private network to share data and the documents, leading towards efficient traceability of the supply chain end-to-end from production to consumption. Blockchain is enabling the highest level of security, hack, and fraud resistance. And in combination with other innovative technologies, we can ensure overview of the physical and digital supply chain. This is now a graphical presentation of a private exclusive network being created within the platform, where the governments, the governmental agencies, payment and insurance providers, pharmaceutical industry and healthcare system, logistics providers create this private ecosystem to exchange documents via CargoX platform. We use blockchain for document management using electronic signature and endorsement, transfer of title, if they are negotiable documents like the bill of lading. CargoX is approved by the international group of the P&I clubs for the electronic bill of lading, but there could be also other negotiable financial instruments supported by the platform. Blockchain is supporting document audit, authenticity, traceability, and as mentioned, in combination with other innovative technologies like IoT and AI, there is an extra layer of value towards the vaccine supply chain stakeholders. This is a presentation of a private network being created within the platform. It's a case of a 3PL who has created their own controlled network of governmental agency, a hospital, an airline, vaccine producer. There could be another number of other stakeholders that are part of this private network of this specific 3PL. So the 3PL is in full control of the network of these trusted partners, which went through the digital identity and verification, and all of them have an easy onboarding and access towards this private network. Data and document management. I will start from bottom up. CargoX platform is supporting over 60 different supply chain, logistics, maritime, and other documents, ranging from sales contracts and agreements, indemnity letters, warranty letters, different kind of certificates, transport logistics document, customs documents, supply trade finance documents. So I will start up with a sales agreement being signed between the vaccine producer and governmental agency that has led towards a purchase order, maybe warranty letter issued by the bank, that has resulted in production of transport documents like an airway bill, maybe an export or import customs document, and of course in combination with a temperature report using IoT provider, we can log the whereabouts of this specific purchase order and the temperature status of this specific shipment. We use blockchain for document audit, electronic signature, and electronic endorsement. This is a case of a sales agreement being produced by this governmental agency, signed by this authorized person working within the governmental agency, countersigned by the vaccine producer, and we use verifiable electronic signatures in a way that you can trace each document back to the source, who has created and who has signed or endorsed each specific document or record. By that, we provide authenticity, identification, traceability, and transparency towards the supply chain. CargoX is following UNCITRAL model law for electronic records, as well as EUPC rules for electronic records when it comes to e-presentation of the documents to the banks. We follow development of UNCIFACT standards for the electronic documents and records, and we are also working closely with ICC, DSI group, on setting forth standards for the electronic bill of lading and electronic documents and records. CargoX is providing two levels of access for the small and medium markets. For the smaller organizations, they can access the network and the platform using the web application. And for the larger enterprises, maybe the regulators, governmental agencies, we also support a deeper integration into any kind of ERP or TMS system using the API protocols. So the platform is simple, secure, compliant, and integratable. We are managing both structured and non-structured documents and records. With this, I would like to also show you a quick snapshot of the platform for better understanding how the protocol of exchanging the documents and records looks like. So with this, I do thank you for the attention. I'm hoping that CargoX can really add value to the COVID vaccine supply chain and be also a bridge between different ERP systems for the highest level of trust, immutability, and tracing of the supply chain of the COVID vaccine. If there's going to be opportunity to address some questions, I would be happy to answer. With this, thank you very much, and goodbye.